All right, so the first anemia we'll talk about is iron deficiency anemia. This is the most common nutritional disorder in the US, possibly the most common hematologic disorder in the US. I haven't seen the numbers on that. It just makes sense that it would be. What are some risk factors for iron deficiency anemia in children? Toddlers who consume a lot of cow's milk are at risk for anemia for two reasons. It can replace other foods. Cow's milk is very poor in iron, and it can replace other foods. So they're eating less of foods that might have more iron, but also it can be hard on their digestive system and cause microscopic bleeding. So they have that little bit of loss all the time, plus not getting in adequate iron to begin with. Preterm infants have a lower supply of iron at birth. Remember that the fetus builds up iron stores in the last part of pregnancy, and those iron stores are usually enough to last to somewhere between 4 and 6 months. But premature infants have lost the last weeks of pregnancy, and so they have lower iron stores at birth. Adolescents are experiencing rapid growth. They're at risk for poor nutrition because of their lifestyle, everything that's going on in their lives. Adolescents who menstruate are having some loss, and adolescents are also more likely to be involved in strenuous activities, which may increase their oxygen need. Also, obesity increases the risk for iron deficiency anemia. And menstruating women are at risk, and that's because of chronic loss. They have to have more iron to actually keep up with that loss. Pathophysiology of iron deficiency anemia. Either the patient cannot take in enough or doesn't take in enough iron or does not absorb enough iron to maintain adequate hemoglobin levels. Vitamin C promotes absorption of iron. So if someone's on an iron supplement, we would recommend that they make sure they're getting adequate vitamin C as well. Calcium and tannic acids interfere with absorption of iron. We live in the South. Tea is very high in tannins, and there are people who drink sweet tea all day instead of water, and that actually can interfere with iron absorption. So that's one of those things to kind of think about if someone's severely anemic or moderately anemic. And calcium also can interfere. So again, that's another way that too much milk in toddlers can promote anemia. Iron is essential to the formation of hemoglobin. So without enough iron, first, they'll make the same number of cells with less hemoglobin in them, and then they start making smaller cells. Okay, so they get hypochromic first, less hemoglobin in the cells, and then microcytic, smaller red blood cells. Iron deficiency anemia is usually managed by supplemental iron. Formula-fed infants should be receiving iron-fortified formula. Breastfed infants after 4 to 6 months need to be getting either iron-fortified cereals or iron-containing foods. We also can add iron-rich foods to the diet. This would be a good time, hint, hint, to go back and review what foods are high in iron, because that might be a question, but that might be questioned on the test. Oral supplements. If someone can swallow pills, that's easier. If an oral liquid supplement will stain the teeth, and so we want to have the child take that with a straw. And we need to know and make sure that our patients and their families know that supplemental iron often turns stools black. So one of the things we're looking for sometimes to figure out why someone is anemic is if they have signs of GI bleed, but iron supplements will turn stools black. So that's something we would have to be aware of. For more severe iron deficiency, it can be given parenterally. IM iron is painful. It also will stain the subcutaneous tissue, so we would use a Z-track method. IV is occasionally associated with allergic reactions. So IV iron has been known to trigger anaphylaxis. So Either way, parenteral is not much fun, but it is possible. If someone has severe iron deficiency anemia, or if they really need correction immediately, then transfusions might be done. But this is done much less often for iron deficiency. The goal with iron deficiency anemia is to increase the iron, because the patient can then make enough of their own blood cells. So diet education. This is, have we been through the latte? We looked at what the patient would look like, what we would assess, what tests would be done, what treatment. Now we're on education. We want to be able to teach patients about iron containing foods, that they need to make sure they're getting adequate vitamin C. Consider supplementation for breastfed infants after 4 months. Recommendations vary between 4 and 6. I'm not going to test you on whether a 5-month-old needs iron supplement. Okay, so don't stress, but between 4 and 6. And avoid excessive cow's milk for toddlers. Under 12 months of age, no cow's milk. They should be getting breast milk or formula. Okay, that's all for iron deficiency anemia. The next section will be on sickle cell anemia.